Are you suffering from a cervical spine condition that requires surgery? If so, you may want to consider the OPEN DOR posterior cervical laminoplasty procedure. This innovative surgical technique offers a minimally invasive solution to cervical spine issues, allowing for effective treatment with minimal disruption to surrounding tissue. KYPOINT1 use the unipolar electric knife to cut the fascia and peel the muscle under the periosteum. Be sure to protect the articulosynovial joint and keep the ligament at the root of the spinous process intact to maintain the integrity of the cervical tension band. Pay attention to the gradual increase of the door opening. Use 2 small spatulas to open a small portion of one vertebral plate. Then repeat the process on the other plate, gradually increasing the width until it reaches the ideal width of 4 millimeters to enlarge the spinal canal. This method helps to avoid complete fracture of the slotted side as much as possible. 3. When opening the door unilaterally, biting off the ligamentum flavum at the opening site can cause bleeding from the venous plexus. If this happens, apply bipolar electrocoagulation or gelatin sponges to stop the bleeding. It is important to remain calm in this situation. Figure note: our exposure of the lamina from the bottom of Celsius 2 to the top of T1. B. Drilling of the lateral groove with a complete osteotomy on one side and a partial osteotomy on the other side. C. Elevation of the lamina from Celsius 3 to Celsius 7 as a single unit. D. Placement of an allograft bone spacer. Figure note: intraoperative view after drilling holes in the lateral grooves of Celsius 3, Celsius 5, and Celsius 7, and after placement of an allograft rib spacer. However, its bone graft material, in addition to allogeneic bone, Fig. Is a vertebral autogenous bone graft made of polylactic acid mesh, as shown below, BC, Fig, which is less common in China. In terms of the width of the door opening, the ideal width is considered to be 10-15, which is slightly different from the 8-16 above. When performing a single door opening of the vertebral plate, biting off the ligamentum flavum at the site of the door opening may result in bleeding from the vein. At this time, do not panic. You can apply bipolar electrocoagulation to stop the bleeding or gelatin sponge to stop the bleeding. If you are considering posterior cervical laminoplasty, open posterior cervical laminoplasty, we encourage you to contact our team to learn more about your options. Our knowledgeable staff will answer your questions and provide you with the support you need to help you make the best decision for your health and well-being.